Welcome to Fierce, Fun, Feminine, and Other F Words. I'm Christine Elizabeth, and I help women unstuck themselves. Today's guest is Kristi Gates. She raised a daughter that was diagnosed with bipolar disorder at a very young age. Now, this daughter is 26 years old, and they think she was misdiagnosed. But the story today is what Kristi went through as a mom, trying to get help for her daughter that obviously had something going on with mental health. You're not going to want to miss this, but also I interviewed her daughter back on episode 14. So go find that one after you listen to this one. Together, they're a powerhouse duo. Are you ready? Let's get started. Welcome, Kristi. I'm excited to hear your story. I know you're going to help a lot of women listening. Thank you for being here.
You're welcome. Thank you.
Yeah. So what I would love to do first is just for our listeners, give a tiny snapshot of what it was like. How old were your children? What was life like for you when you started realizing, I might have a child with mental health disorder?
Well, I have one child, and that's Cassie.
Okay.
So my attention was all on her, which was probably a little bit easier than if you have multiple children. And I would say the first time that it really showed up must have been around that 11-year-old age, the preteen type age, when I realized that she probably needed some help.
Okay. What kinds of things were happening that made you think that?
The biggest one is what we called her episodes, and that's when I took her to the local doctor because we lived up in a mountain town, so we didn't have access to more. He was just a general practitioner. But her episodes would be mostly in the evening when she was trying to wind down and go to sleep, and she would just get anxious, anxiety, wanting to leave the situation, leave the cabin, almost feel like she would want to peel out of her skin. If that started when she was still awake, many times I would put her in the vehicle and we would drive just to get her out of the situation until she took a deep breath or even just fell asleep in the car, and then come back and put her to bed. And the next day we would just go on like nothing really happened. Then it turned to going to sleep. And sometimes in the middle of the night, she would just start thrashing in the bed, waking up, physically being like wanting to hit something. And I would have to physically hold her down because she was not fully awake, had to physically hold her down. And sometimes that was half an hour, 45 minutes until she went limp and went to sleep.
Wow. Okay.
In the morning, she would not have recollections of those.
That was going to be my question. She didn't remember any of it.
Not the ones that happened when she was half asleep. She would remember the ones that happened when she was already awake. Obviously, the next day, sometimes we would talk about it. She goes, I just feel like I have to leave. I just need to get out and run. But when she was half asleep, when it would happen while she was sleeping, she would not remember it. Okay.
And what was her temperament? What kind of child was she? Would you describe her as, when this wasn't happening? Was she, would she fit the normal kid description, whatever normal is? Do you know what I'm trying to say? Was she?
Yeah. For the most part, well-rounded, well-liked. She always had a tail of friends behind her, at school. Everybody always enjoyed her personality at school, outside of school. Adults loved her. When we got home by ourselves, that's when she could let down her front and be her, which would be a bit short-tempered. Sometimes just wants to be in a quiet area, not a lot of outside stimulation. Her home, me, I was her safety net sometimes her punching bag, but outside of home, not a problem.
Okay. And how long did this go on before you thought, I can't manage this by myself anymore? I need an expert professional opinion. How long were you trying to do it yourself?
Probably like once the episode, well, I kind of noticed a little bit before the episodes, just the whole being able to hold the polite child. Everybody likes her outside, but then she would come home and get a little bit upset with me or whatnot. I kind of, that was a little bit there. And this was also this was right at the time people just started to look things up on the computer.
Okay.
Right? I mean, it wasn't like now where people are like, oh, what's that? I'll Google it. We didn't have Google then, right? So,
right.
and my background was, my dad was a cowboy. We didn't have stuff. We were outside. So when she got a little bit snarky and naughty with me in a way, it was like, then go clean the barn. Go do, I handled it in the way of work ethic,
yes.
Which looking back, I honestly don't think it was that bad, I mean, and so when the episodes started to get to the point where we had more than not of her waking up in the middle of the night and I had to hold her down because we lived up in the mountains. If she decided to run out that door, there was a bear or a cougar or something, right? I mean, it was not safe for her to run out the door. Right. And so that's when I took her to the general practitioner up there. And unfortunately, also at that time, the medicine that supposedly helped was, I think it was Prozac, which then led to more problems down the line. But I did not keep her on that very long either.
Okay. I definitely want to get into what happened in the treatment. So would you say you wrestled with this for 1 month, 3 months, 6 months, a year? How long would you say?
Probably, I would say I wrestled with it somewhere around a month.
Oh, you didn't give
maybe
it long?
6 weeks.
Okay.
Oh, no, because that's not right. You having to hold your child physically down in bed.
Yes.
That's not right.
Yes. Okay. And for any of our listeners, yes. And I want our listeners to kind of have an idea because they may be going through this right now going, I don't know what to do. So, someone that's been through it. And if any of our listeners are listening to this episode and you haven't joined me before, Kristi's daughter is in episode 14. So if you want to go back and hear her version of the story, she's the one that was diagnosed with bipolar disorder. Kristi today is her mom. So she's going to give you her version, but also what she thinks really actually happened. And maybe it was a misdiagnosis. We're going to hear more later. But I want you to just hang with us. If you're in this right now, Kristi has a lot to share. And Kristi, I would love to know, did you try anything naturally before you got to that 1 month, 6 week point? You used work ethic? Did you think maybe it was her diet? Did you do all of those kind of things? What were you trying besides work ethic and just calm? And did you notice any triggers? Did you notice anything that was a potential trigger, or was it just a certain time of day?
I think, so also prior to this, she was diagnosed with type 2 diabetes. And so we were trying to watch her diet and making sure it was low sugar, high fiber, blah, blah, blah. Again, this was at the time where things were not as accessible information, so to speak. And then I think the triggers were just pretty much like the unwinding at the time of day. I did also notice going into big stores where there was lots of activity. She's like, yeah, I'm done. She couldn't handle being in there for long with all the chaos.
Yeah.
And no, I mean, I didn't have her on anything natural, like trying vitamins or anything like that at that time.
Okay. And so let's go into now, you take her in for evaluation. What happens next?
Well, the first evaluation was depression.
Okay.
And again, that was just from our general practitioner.
Did you agree with that? And did you think, oh, okay, we have an answer. She's depressed, or did you feel like that wasn't enough?
I guess to a certain extent, I felt that was a reasonable answer at that time. Her father was a very clinically depressed person. So I thought that, it's kind of in her bloodlines a little bit.
Okay.
So I thought, well, okay. And then the episodes got worse. And that's when I reached out to more of a mental health counselor. And at that time, again, this was so long ago,
Yeah.
I don't remember exactly if that counselor diagnosed her or not at that time. We then kind of timeline, that must have been around like 13 years old or so, 14 years old. Again, not on any medication other than metformin for her diabetes at that time.
Okay.
And then when she was like 15 or 16, when issues really got bad, that's when she was diagnosed with bipolar and the psychotic episodes and that information, and was put on a lot of medication at that time.
Okay. So I remember her story when I did her interview, and she gave me goosebumps when she told it. Your daughter is incredible. She's incredible.
Thank you.
So
Thank you.
articulate, so confident. So, and I know it's a struggle for her still, but her interview was rock solid. I remember her telling the story of that day. Do you remember the details of that day the way she does? Because it sounded to me like she went in without you for the evaluation, and then she came out and met you. That was what I remember, but I could be wrong. Do you remember the details?
Yeah. No, I was there. I don't think she ever went into a doctor's office without me. And I was there, and it was a little numbing, a little strong. And, again, me coming from the background I'd come from, pull yourself up by the bootstraps and march on. And I do remember what I said to her afterwards. I'm like, it's a superpower. You can help people. You can fight this. You can do the best you can do. And you have a superpower. It is not a negative thing. It's a positive thing.
I remember when she said that,
So,
I got tears in my eyes because I thought that's the best mom on the planet. So, okay. So you were actually there when they evaluated her. You were in the room during evaluation. Can you share with our listeners a little bit about what that might look like?
again, it's a long time ago.
Like, what can you expect if you're going in and,
lots of questions.
She was diagnosed bipolar. What was the diagnosis exactly?
See, she remembers that part way better than I do. Bipolar, psychotic episodes, social anxiety.
Okay.
I mean, just a list, a laundry list.
Okay. So how did they come to that determination? What did they do to diagnose that?
Yeah. Lots of questions, lots of tests, like written tests, lots of talking. That's pretty much how they came up with it. Lots of questions for me, what episodes looked like. At that time, she was cutting herself. At that time, by that time, I probably saved her life twice.
Okay, we didn't even cover that. So she was also trying to end her life. I didn't even get to that. Okay. How were you doing? How were you doing as a mom at this point?
Waking up and putting on my boots and doing my work and making sure that she was still alive. I will tell you this, at some point I would lie in bed and plan her funeral, because what else do you do?
Okay, what was your life outside of Cassidy at this time? What was going on in your world? You were working full time? Were you managing your barn at this time? What did your life look like?
Yeah, I was, I felt very lucky that at this time, so Cassidy's father passed away when she was 18 months old, I think. And luckily there was enough money that I did not have to work full time. I could dabble around in my horse stuff, teach a few people, but I could be a full-time mom. I didn't have to send her off to daycare. I didn't have to burn the candles at both ends at this time. And so I could be very attentive and on top of it. And, there were days where if, she couldn't find her socks, right? And that would be the end of the world. And I'm like, breathe, I'll go find you some socks.
Right.
Just making sure that she could function.
Okay.
And again, when she went out in public, she could function fine. So,
yep.
Yeah.
Home was she just deflated and was her real Cassidy self at home, right? Yeah,
exactly.
So did she threaten suicide, or was it something that she just was trying to do without, you knew it was happening, but did she give you any warning that it was coming, or did you just find her trying an attempt?
No, I think honestly, at that point when she had the suicidal thoughts and moments, it was almost like a different type of episode. Okay. I remember this was like, she must have been 18 or 19 because her husband was her boyfriend at the time. I remember sitting on her in the yard, holding her arms down, going, you're not getting up. And she had to go limp before I would get off of her because she was done.
Okay. And now that we have this picture of really how serious it was, you leave this diagnosis, this appointment, she gets in the car and you say, this is not negative, this is your superpower. What were you armed with to manage this? And did it help? What did they give you? What did they tell you? What was, you already know that she's diagnosed with bipolar disorder. How did you feel about that diagnosis? Did she respond to that and feel like, oh, I have an answer to? How did that affect her? What did life look like, let's say, in the next 6 months or so?
I think the only thing we were really armed with was a lot of medication. Right? I had to legally sign forms and be walked out to the car with, and you're going to ask, I don't know the actual medications anymore, but it was one to wake up. It was one to go to sleep. It was one to handle this, one to handle that. And I wasn't for that so much, but I thought, well, we'll try it. As a diagnosis at that time, I'm like, well, they're the experts. I guess we'll roll with it for a little bit. And Cassidy is the one that has, and I've just totally agreed with her, that she has come up in this last several years going, I think I was totally misdiagnosed. And I totally agree with her. She's the one that does her research. She's the one that took herself off the medication. Oh. I supported her.
Oh, wow. Okay. So
that's her superpower. She wanted to be better.
Okay. So how old was she at this point where she was diagnosed?
I want to say 16, 17, somewhere in there, because she was still in school.
Okay. And did the medications change her? Did she take them you said she went off of them. How long did she take them? Did they make any difference? What did you notice?
I honestly don't think I don't think she took them that long. We had a moment. So this is just bringing up memories. She had one to wake up. She had one to go to sleep. She had one to help lose weight. She had one to be happy. There was like 4 or 5 different ones that she was to take within a day. I mean, how does that mess up a body? And so I remember she was on them for several months, 4 or 5 months maybe. And we went in to the prescribing nurse, and she had to have a checkup and a weigh-in, and she had gained weight. And this prescribing nurse made a mistake. And I think this was also a very good point to Cassidy, how I was there to be her advocate and stand up for her, and nobody would, if I felt it was wrong, I don't care who you are, you were not going to do that. So this prescribing nurse weighed her and made the comment how she gained weight. and how could she gain weight taking this pill? Well, there was 5 other pills. And she said to her, and I remember this so well, Christine, so well. She's like, I put pictures of a movie star on my refrigerator because I want my body to look like her. Maybe you should find somebody who you want to be like. Best thing about Cassidy, she never really had a body image issue.
But she does now, right? I'm not saying
well, not after that day, because my eyes about popped out of my head. Oh. My fist hit the table, and I'm like, I can't believe you just said that. Are you kidding me? You need to go check where you got your degree from. I grabbed Cassidy, I swung the pills across the table, and we walked out of that waiting room.
Thank God.
And everybody watched us walked out. And I'm like, not on my watch. No. And I walked down those steps. I'm like, Cassidy, you are beautiful. You are strong. You are powerful. That woman is not.
Exactly.
And we got in the car and we never went back. Never went back.
Thank God. I work with body image. So this right here is one of the perfect examples of how the health industry is harming people, right? Yes. But I'm really shocked that she was there for mental health and someone would shame her. I mean, shame?
That was my reaction.
What?
Yeah.
What?
Yeah, it was horrible.
Okay,
horrible.
So after that happened, is that when all the meds just ended?
Yep, I just ended them. I threw them away. I'm like, got on the computer, started looking up natural stuff.
Okay.
Found, Vitex, I think, was a big one. And lots of green tea to help flush everything out of her system. Lots of ups and downs, lots of physical contact. Because her body was going, her brain and body was going through lots. And, I just did it myself.
Wow. Okay. So for our listeners who may not understand, you may be a little bit less inclined to do something like that. Kristi has a background in trying to figure out horses. And I know we can't compare horses to humans, but I
do every day.
You do every day. And so Kristi, how does that background help you? How did that background because you had horses that were challenging, you had to figure out what was going on with this horse.
Mm-hmm.
How did that work help you as a mom with your daughter?
It has helped me in so many parts of my life. Horses can talk, but they use body language, right?
Mm-hmm.
They don't use English language. They can understand English language. But, sometimes we have to diagnose horses without, and guess and trial and error and gut feelings. We have to listen to our instincts, where a lot of people don't listen to instincts anymore. If it's not on Google, it's not right. My dad was, like I said, I'm a second generation horseman. Cassidy's a third. We now have a fourth in the family. We're around animals all day. We have a 20-acre farm. You listen to the instincts. You hear things. You're like, whoop, that's not the right sound. I better get out of bed at 2:00 in the morning. You're on your psyche is on high all the time.
Yes. And just so you know, if you're listening, her horses are not just pasture pets. Kristi is raising horses that are winning awards and show. Can you give a little background about that, just so we can kind of talk about that for a second? Because it's so interesting. You're not just raising a pet that you can go trot around your driveway, right? So the healthcare of your horses, the healthcare of your, background, that really matters. What type
Absolutely.
What type of horse?
In my barn, my horses have their own doctor, their veterinarian. They have their own chiropractor. They have their own massage person. They have their own shoer, pedicure.
Right.
They have electric blankets they wear to help their bodies relax. They have magnetics that they wear to help their bodies relax. They have a special diet with natural supplements to help their bodies perform and their brains to perform. And every animal is treated different. None of them fit in the same box. I have some that I can put everybody on, could put, great grandma on, and I know that that person will be okay. I have some that is like a Ferrari race car. Only certain people can ride because that horse is powerful and energetic. I have to read these animals. I have to match them up with the right people. I have to make them successful. Cassidy, when she was younger and showed her ponies, she was national champion everywhere. That doesn't come from not knowing horse and human.
Yes. So this really came into play. I'm positive came into play into your mothering and parenting through all of this. So I just want to say props to you, because talk about I can't imagine when you have this going on as a mother, what it must have felt like for you. So what were some of the thoughts going through your mind? Because you're a doer. You're like, okay, let's find a solution.
Yep.
Let's find a solution. Let's find a solution.
Yep.
What was going through your mind? Did you ever feel defeated? Like you said you were planning her funeral at one point, but I mean, where were you? Were you comparing yourself to other moms? Were you ever in a verbal beatdown of, I'm doing this wrong? Or were you just keeping forward? I mean, what was the honest,
I never compared myself.
Okay.
I never compared myself, and I never compared her. And I, when the biggest time, I think, when I thought I was going to be planning her funeral was when she had a car. She had graduated. You can only do so much. People are going to do what they're going to do. And you can't keep your children in a box. And so that was the time that I would lie in bed at 3:00 in the morning, and her car is still not in that driveway. And that's when those thoughts, I think that was my darkest time, honestly. Not the suicidal part or, me holding her down in the middle of the yard when she was 19 or whatever. That night, 3:00 in the morning, that was my darkest time. I'm still a little bit scarred by that. Even now, she's 26, a great mother, a fabulous photographer. I'm like, I'm just checking in, making sure you weren't in a car accident, making sure, and bless her heart, she doesn't get pissed off about it.
That's awesome.
She's like, yeah, I'm here. I'm okay. I'm fine. Super. That's all I need to know.
Love.
And I think honestly, a little bit of that comes from her dad passing away too, because we called him and called him and called him. He didn't answer. And then he was gone. So, that's my scarring there. But like I said, my darkest time was when I was planning her funeral.
Okay. How did you get through the no medication? What did it look like? Did she change for the better on all of the, now we're not recommending and we're not saying take your children off medication and get on green tea.
Yeah, no, don't.
Right now.
Yeah.
Not take this as medical advice, seek a professional. But Kristi is sharing her story as a mom so that you can hear what her journey was like in case you might be facing something like this right now. But so Kristi, when you get into, like, now she's off all meds, she was 16, we're still there. So now we're moving forward into 16 to whatever age you want to take us to.
Yeah.
She was off medication, going all natural. You were doing different things. What did you observe in her? What changes did you notice?
I would notice extremes. Okay. And I would notice either super happy and, ready to get up, ready to go, going, la, 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 to Cassidy, it's noon. You have 5 minutes to get out of bed on your own before I come in there and lift you out by myself. So get in the daylight. It was a roller coaster.
Okay.
And even now as an adult, I am the first one to recognize stuff just because I'm outside looking in. It's easier to recognize that. And even not too long ago, a month ago or so, I I told her, I said, Cassidy, I can tell you are struggling. You're struggling mentally. You're struggling physically. And I just want you to know I'm very proud of you. You make sure your child gets to school on time. You show up for your work appointments. But at home, I can see where you are struggling. And I just gave her a big hug, and she cried, and she's like, thank you for that support. And after that, she heard that. And from that day on, you could see her coming out of her low spot. And I think it's that hearing that somebody recognizes and has that same feeling she does. When she's low and struggling, it hurts me. I tense up. It hurts me. I have to breathe and then help her breathe.
Okay. She has a child. She's married. I know this little girl, your granddaughter, is just the love of your life. What is it, and what is it now? So you are several years through some of the darkest times, and you said that you feel like she was misdiagnosed, or she thinks that she was misdiagnosed. So what do you both, have you discussed that? What does she think? What are you both thinking as far as the diagnosis goes?
Well, she came to me and a lot of podcasts and a lot of things on YouTube, and really tries to and looks things up all the time, and is always trying to find something to help her, right? And the changing and the herbs and whatever else. And she came to me and told me that she felt that she was more ADHD. This is where I can't remember a lot of things. Head injuries. ADHD.
Okay.
It's a disorder where, and she described some of the symptoms. I'm like, wow, that's you, right? You know, like, okay, being in a really messy room, right? She does not like the clutter. She does not like the chaos, but she can't look past it or just like start making it better. On the outside, people think, God, what a lazy slob. But on the inside, she's scared of it.
Right. It overwhelms her.
It overwhelms her. I think she's more anxiety, overwhelming. I really don't think she was bipolar.
Yeah, because we can have, what you must have done a deep dive on bipolar and said, okay, bipolar disorder looks like this. What were you told to expect when she was diagnosed with bipolar? What did they say that was going to be?
You know what? Honestly, I don't think they did.
Oh, really?
Like I said, we marched out of that office. I just think we got the diagnosis, and maybe we got a whole packet of stuff. I don't remember. Again, it's been a long time. And I'm sure the mental health community has changed quite a bit since then. But I think it was just pretty much take these pills and keep coming back for visits is pretty much what we were doing. I did like one of her counselors who gave her lots of breathing techniques, the box breathing, which I have taught to my older adults as they got nervous going into the ring. I mean, there's a lot of things I learned that I use in my training. Yeah. I'm not quite sure if I ever really was fully educated on that, or educated myself for that matter on that.
Talk a little bit about therapy. Do you think therapy was helpful for her as a younger child? You said she was a little bit. I do, and I remember most all of this. I had a very close significant other, and he came to a couple of the sessions, and the therapy was more of like learning to, or talking, identifying it, and learning to live with it a little bit. I guess not really try to fix it as much as, this is your child. Okay.
This is how it's probably going to be.
Okay.
And again, that's when she was like 11 or 12, 13, somewhere in there.
So that was therapy for you. You were in therapy.
All of it. Yeah. Like, we would go for her. They would talk to me and her. My significant other came in a couple of times.
Okay. Definitely a family effort.
Yeah.
Okay. And so to wrap this up, it sounds like you've taken us on a great journey. I have a great picture of what happened from when she was 11 until today at 26. It seems like, okay, something's wrong. I gave it like a month to 6 weeks until I said I need professional intervention to,
Yeah.
oh, no, you're not going to shame my daughter, and walk out.
Yeah.
No meds.
Yeah.
You went more of a natural route. And
Uh-huh.
instead of your discipline, your form of discipline was work, it sounds like. Am I right?
Uh-huh. Uh-huh.
Okay.
Uh-huh. Absolutely.
And her life outside of the four walls of your home looked a lot different than what it looked like inside for you. You saw different
Correct.
Cassie than the world saw.
Uh-huh.
Okay.
Uh-huh.
And once she aged and got through puberty and got a little older, she met the man of her dreams. She fell in love. She got married. She had a child. And now she's 26. So today, you both feel she was misdiagnosed, but she has a handle on it. Do you feel like there's a handle on it?
Yeah, I do. I really do. I mean, I guess the other thing I want to say, just because of clients that I've had over the years, and I see teenagers, and then going through quote unquote depression, puberty, and parents running to the doctor right away and getting them on medication right away and whatnot. I really, I guess even now, I really dislike all the labeling. And you are who you are. I mean, I know as an adult, as I get older, I don't like to be in stores that much. I get anxiety about it. I'm like, yeah, too busy. I'm out of here. I don't need a pill for it.
Yeah.
I just know that I don't like that situation. So, I don't need to be super social and go to lots of busy places. It's okay that I don't like that. It's okay to have some type of anxiety. We all have anxiety. We all have a little bit of depression. These poor children going through puberty. Yeah, trust me, your hormones are going to be off. You're going to be happy one day and crying the next. There's nothing wrong with it.
Yes. And boy, talk about that with women going through perimenopause and menopause. It's the same.
Yeah. Hello. Yeah.
It's the same.
It's that whole circle of life. We do it once, we get to do it again. I mean,
yeah, love it. Okay. So what if you had one of our listeners who's a mom who is thinking, I don't know what I'm dealing with right now, but I know it's not normal. It's not healthy. And it seems like it's a mental health type thing that you may have described a similar situation of what she's going through. And you're sitting at coffee across the table from her. What are a couple things you would say to her to encourage her that she could do, like as soon as she's finished listening to this podcast, that might be helpful?
I would start journaling things. So you can show the doctor timelines. So if you go into a counselor and whatnot, you can show, okay, so she was fine at 8 a.m. This happened, and then this happened. If kids start to have episodes, journal it.
Great feedback.
I mean, yeah. I mean, I love writing things down now. I wish I learned that a lot earlier in life. And educate yourself. I mean, it's just like that prescribing nurse who was going to body shame my child. She had 4 different degrees on her wall. Doesn't mean she's right.
Love that.
Educate yourself. Ask good questions. You asking questions is not questioning them. It's getting answers for yourself. I've had veterinarians that have gotten mad at me because I've asked questions, and I look them straight in the eye. I'm like, I'm not questioning you. I'm asking questions so I understand and know.
Yes.
And if they don't want to answer those questions, find somebody else.
Yes. Yes. You have to be an advocate. That is being an advocate really for your child.
Yeah. Yeah, absolutely.
It is really, especially in today's world. I've talked to a lot of people in the health profession that are fried, burned out, tired, with all the things that have been happening in our world in the last year and a half or so. Yeah. And they're not, they are too tired to really look at you as an individual. You're clumped into a profile. Oh, you fit this profile. Do this. You fit this profile. And you have to rattle them and shake them awake. Just go, no, 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 no. But before all of this pandemic stuff, I will say that was true for my dad when he was in the hospital with pancreatic cancer in ICU, when the nurse only had 2 patients. This was on the East Coast. But I mean, my sister is a nurse, so she knows the drill. And these nurses were still missing some key things, like certain things that were supposed to be happening. And if she weren't there advocating, he wouldn't have had the right medication at the right time or had the right appointment with the right person. I mean, advocating is huge. You can't just go in there blindly and say, I don't know, you're the professional.
Yeah, nobody knows your child or your father or your mother as well as you do.
Right.
I was my mom's caretaker until the day she died. And we, on top of dealing with Cassidy, I was also taking care of my dying mother. And so when we would take my mom into doctor's appointments, I would go in there and I said, A, B, C, D. And her doctor was so wonderful. He's like, you're making my job a lot easier. Thank you. I said, well, I have to notice when the horse flicks its ear wrong.
Right.
I notice tiny little things. If you notice something tiny about your child and you're like, don't ignore it. That's your instinct. That's your motherly instinct.
Definitely. And there is a difference. I think that some of the resistance you get from the medical profession is someone that comes in with all this Google information who acts like they know more than the doctor. That's not what Kristi's recommending. She's not saying that you're Google certified in mental health. She's saying, this is what I'm seeing. These are the patterns. Here's the journal and the timeline of things that have been happening. I'm wondering if it could be this, or what do you think of this? Not go in and tell them that they're wrong or not. I think there's a difference. There's a fine line of going in equipped with information versus telling the professional that you're talking to that you know better than them. It's more of a partnership.
Exactly. I was going to say 2 minds are better than 1.
Yes.
And they both have to be soft enough to listen and to absorb. And they both have to have the same want and outcome to help the patient.
Love it. So before we close, now I think journaling is probably one of the best things I've heard that you could do for this, because as a mom, you probably, even now, like you can't remember all of the little details. If it was written in a journal, you have it. So I love that you shared that. Did you give the teachers, was there any communication between you and the teachers? Or did you just let her go and not have
No, I think, again, she didn't have problems with the teachers. She didn't, that was outside of the house. Teachers loved her, especially when we got her to this one school where it was a parent partnership school. But because she finally got in there around 8th or 9th grade, I didn't have to be there all the time. She led conversations. She loved it. Teachers loved her. There was never a problem with a teacher. I'm trying to think back if there was maybe one, but I don't think so.
Okay, that's awesome. You have been, you've been a great mom. First of all, you inspire me just listening to, everything. I've dealt with a daughter with anorexia, and I did a lot of things wrong in that whole thing. And my lessons that I learned, now I'm taking those and I'm helping other people not make those same mistakes I did. And I went through, and I have to say her experience was completely different than your experience. Her experience with the mental health professionals saved her life. But I had to take on I had a lot to learn because I was part of the problem. But now I'm taking this and I'm trying to help moms not make those same mistakes and, to know what to look for. And that's why I love your interview, because I feel like you have so much insight to share and you're sharing your story. What would you say to moms that are going through it right now, how to move forward, how to keep moving forward and not get fatigued, or maybe they do get fatigued? What would you say to them?
Mm-hmm. One thing is that I think you have to put yourself in a caretaker situation, because that's what you're doing. You're being a caretaker, and you do have to take care of yourself. I think looking back, I maybe did or didn't do that for myself as much, or maybe I felt like I didn't need it. I don't know. And to have moments for yourself, to take walks, pamper yourself a little bit, because when you became a mom, it's a 24/7. It's a 24/7. And even when they grow up, you're still their mom. And if you are the person that they depend on, you're going to be there until one of you is gone, type of thing. You know, I mean, it's not just because they hit 18 and you're done. It's a lifelong partnership.
Yes.
And that's why the breathing or the moments or the quiet time or go read a book or do something for yourself, that's okay. And it's okay to step away for a weekend, and it's okay to let somebody else help. Oh, that's letting other people help, listening to other people. I've found that some mothers will be venting a little bit or sharing, and I don't say anything until I hear something like, oh, they need to hear a little bit of my story, and I think my information will help them. And I just give them my information. I don't say this is what you need to do. I just say, this is what happened in my life. This is how I dealt with it. You might look into it, or you might talk to your doctor about it, or whatever else.
Love that. So moms, take care of yourself and know you're not alone.
Yes.
I think that's
absolutely.
Kristi, thank you so much for sharing your story. I really appreciate you. Thank you for being here.
You're very welcome. Very welcome. Thank you.
This episode in no means is medical advice. If you suspect your child is struggling with anything in the mental health world or health world in general, seek professional help. Seek counseling. Find a professional that specializes in it. Today, we wanted to give you hope and ideas and inspiration to keep pressing on, because it's hard being a mom, and it's hard when you're guessing, trying to figure out what things are, what's going on. And if this is for your child, we don't want you to feel alone. Other moms are out there, they've been through it, and they're here to help and support you. If this episode was helpful, don't forget you can always hit subscribe and get notified when the next episode releases. And if this was something that you think would help a friend, feel free to share it. Until next time, have a fierce, fun, feminine, and fabulous day.